Hey everybody, welcome to Pick Dr. Osborne's Brain. We're going to be diving in today about adrenal fatigue or adrenal dysfunction. So we're going to be talking about the symptoms, we're going to be talking about what you can do about it, what supplements might be supportive and helpful. We're going to be talking about a number of different causes, so stick with me through the end. If you've got questions specifically regarding adrenal gland fatigue, make sure you go ahead and get those typed in now. I'm going to answer as many as I can as we get to the end of the show. So without further ado, let's jump into this crash course on adrenal dysfunction. So first, I think it's important that you understand what the adrenal glands are. We hear this term adrenal fatigue or adrenal burnout. In the medical community, the term adrenal fatigue or adrenal burnout is oftentimes laughed at. It's oftentimes considered to be a fallacy or a kind of one of those purple unicorns, so to speak, a thing that doesn't exist, that people just kind of make claims that they have. But in reality, adrenal fatigue or adrenal burnout is a very, very real issue. And so let's first talk about the adrenal glands themselves. So if we look at this diagram, you can see here the kidneys. On top of your kidneys sit this triangular shaped organ. That's called your adrenal gland. Now it's made out of two major pieces. It's made out of an inner layer, you can see here detailed in pink, that's called the adrenal medulla, and it's made out of an outer layer or cortex, oftentimes referred to as the adrenal cortex. Now, simply put, the adrenal cortex produces some of the hormones of stress, most notably the adrenal cortex, just like its name, cortisol, is responsible for the release of cortisol, whereas the medulla is responsible for adrenaline and noradrenaline. And some people call it epinephrine and norepinephrine. So these are the hormones of acute stress, right? Cortisol, noradrenaline, and adrenaline. And so these glands, these adrenal glands that sit on top of the kidneys, produce other hormones as well. For example, the mineralocorticoids. We won't get so deep into that tonight. But these help regulate your water and your blood pressure. And then also DHEA, which is a hormone. DHEA stands for dehydroepiandrosterone, and it's a hormone that is a precursor in women, helps to produce estrogen. Progesterone in men helps to produce testosterone, so it's a precursor hormone to those things. So again, cortisol, though, is what we're really going to be talking about tonight with adrenal fatigue and dysfunction. And so what happens, how we go about producing cortisol, because again, these are stress hormones, so it's important that I can't emphasize this enough. These are stress hormones. So the greater the amount of stress that you have, generally speaking, the greater amount of response from these adrenal glands that you're going to get in the form of increased levels of corticosteroids and increased adrenaline, noradrenaline. But the feedback loop or the message is actually driven by the brain to a large extent by the hypothalamus. So in your brain stem here, you have a hormone called corticotropic releasing hormone, and that hormone stimulates the posterior pituitary gland to produce another hormone called ACTH, adrenocorticotropic hormone. Again, the word's going to sound confusing and it's going to get confusing, so I want to simplify this. But my point is this is your brain, okay? And it's your brain that stimulates the adrenal cortex here. So we've got the adrenal cortex is stimulated to produce glucocorticoids or cortisol, corticosteroids, right? So how do we make sense of that for you? If you've ever had a steroid where you went to the doctor and they gave you a steroid injection because of pain, or they gave you oral steroids because of pain, those are corticosteroids that are generally administered through prescription medication. So the same type of drug, if you will, right? Only your body produces it. A lot of people just don't know that. So when you go to the doctor because you're in pain, you get a corticosteroid. What they're actually doing is giving you high doses of what your body already naturally produces. And so think of cortisol as your body's natural fire truck. It's what your body uses to put out inflammation. It's also what your body uses to mobilize more energy when you're in danger. So cortisol causes several different types of chemical affects, and one of them is of course, is to elevate your blood glucose or your blood sugar so that your body can take proper action. And another one of the effects is it's an anti-inflammatory. So let's talk next about what can cause adrenal fatigue. Adrenal fatigue is caused by, again, chronic stress being one of the biggest elements to this. But what is stress? If we look at what stress is, you know, it's this word, it's this term that commonly gets used and thrown about. But what exactly is stress? Stress, is it good? Is it bad? You know, I think it's important to have that conversation. So there's good stress, okay? That's oftentimes referred to as hormesis, which is when you have a certain amount of stress that can lead to good things, you know. And so an example of hormetic stress or hormesis would be exercise, right? So if you exercise, the benefit, the good benefit, right, would be increased muscle mass, strength, increased strength. Exercise also improves blood sugar control, right? So these are all examples of a good effect that stress can bring through exercise. Now, there are bad effects as well. And so an example in this case is if we overtrain, right, you can get injury. Okay, if you work out too aggressively, it can start to disrupt your sleep. It can lead to hyperinflammation and all the consequences of that. So think of stress as being both good and bad. And really, you know, if we want to really think about it, it's a scale, right? On one end and on the other end, you want good stress and you want bad stress to kind of counterbalance each other. You don't want one to be higher than the other, because it's when that happens that we get thrown into this chronic state of stress where overall our bodies start to stimulate the adrenal glands to produce more and more stress hormone, i.e. cortisol, right? So I gave you an example. So chronic stress could be any of these things on this board here, right? So chronic stress could be a chronic infection, right? So one of the things many people are talking about right now is the long C, right? The long viral infection. That's chronic, right? But there are plenty of other examples of chronic infection. There's Lyme disease, a perfect example of a type of chronic infection. Some people have candida overgrowth or candidiasis that's pervasive, then it's chronic, right? So there are a lot of different examples of how chronic infections can create an overstimulation of the immune system, causing increased stress over time, right? We also have hypoglycemic states, so where this is an example of good and bad stress, because if your blood sugar drops too low, it's good that your body stimulates cortisol release to help dump sugar back into the bloodstream. But if your blood sugars are chronically low all the time, then that's not necessarily good, because too much cortisol can start to create problems. So again, it's about the balance between the good and the bad. We know that chronic inflammation and anything that can cause chronic inflammation can contribute to the adrenal glands being overworked, so to speak. So chronic inflammation, this can be caused by food, it can be caused by chemical exposures, it can be caused by excessive exercise, it can be caused by lack of sleep, it can be caused by dehydration, right? There's just a number of different things that can contribute to chronic inflammatory process. And of course, chronic inflammation can also cause chronic pain, as can other things. So sometimes people get into a state of chronic pain, and again, a number of reasons why that can happen. You could have injury like a lumbar spine problem or a disc injury. You could have a neuropathy or a nerve pain that's chronic. You could have chronic pain like a fibromyalgia type disease, which can contribute to chronic corticosteroid release from your adrenal glands. And then some people, what do? To manage the infection, to manage the inflammation, to manage the chronic pain, they take steroids. And a lot of doctors will prescribe steroids, in my opinion, way too aggressively. They'll prescribe steroids before they look for why these problems exist in many cases. And so steroids are very powerful drugs that can stomp out inflammation, right? It can really help a person's chronic pain level and can mask a person's infection. It doesn't get rid of the infection, but it certainly can mask the inflammation that's produced as a result of the infection. So if you think about this, the chronic infection can create chronic inflammation. Chronic pain is chronic inflammation, right? And all of these are forms of chronic stress, which are commonly, again, medicated with an artificial external corticosteroid that suppresses a person's symptoms and really leaves them in a place where they're hanging, where they're not really fixing the problem, but the drug is very, very powerful. Now, we'll talk more about chronic steroid use in just a minute and the impacts that it can have, but let's talk about some of the other causes of adrenal fatigue first. So gluten sensitivity is one. There's actually a number of research studies that link, there's a type of adrenal insufficiency, and maybe it be important if I clarify the difference there real quick too. Let's make some room. So there's the term adrenal fatigue, and it's not the same as adrenal insufficiency. Insufficiency is actually a medical term, oftentimes referring to as Addison's disease. Now, Addison's disease is an autoimmune condition that leads to hypoadrenalism, or your adrenal glands start to shut down and they're not actually properly producing adequate amounts of stress hormone. This is largely associated with celiac disease, meaning many with celiac disease also have Addison's and vice versa. Many with Addison's also have celiac disease. And one of the prevailing thoughts is that people with Addison's should be investigated whether or not they have celiac disease and embark upon a gluten-free diet. Because if you have Addison's, there are case reports, numerous case reports in medical literature that show that individuals with Addison's going on a gluten-free diet see their Addison's disease improve. And I've seen this actually in my own practice a number of times, where people with prior being diagnosed with Addison's found they were actually able to largely recover their adrenal gland function as a result of going gluten-free. So again, an insufficiency, when you hear this term insufficiency, this really refers more to the Addison's aspect. And if you think about adrenal function in the medical world, right? There's really two types of adrenal dysfunction. One is Addison's and the other is Cushing's. And Cushing's is a little bit different. Cushing's is generally where you make too many adrenal hormones, and Addison's is where you don't make enough. So oftentimes what happens is when people have adrenal dysfunction, they go to the doctor. If you don't fit this definition or this definition, they kind of tell you you don't have a problem with your adrenals, even though you might. So again, just a little bit of clarification there between adrenal insufficiency, which again is more of the medical Addison's aspect, versus adrenal fatigue. Now, other things that can disrupt the adrenal glands and create long-term fatigue, one is nutritional deficits, so poor diet. And we've seen this in numerous occasions, and there are a number of nutrients specifically that are very critical for your body's ability to be able to produce cortisol. And we'll talk about those in just a minute too. And then you have chronic caffeine use, because caffeine as a stimulant will overstimulate, over time it will overstimulate your adrenal glands. So not just caffeine, but other stimulants as well. So if you're on drugs, for ADD or ADHD, some of those stimulant medications, these are things that can really hammer your adrenal glands and work them to death, so to speak. And then you have fast-paced lifestyle. So, in the U.S. today, we're especially guilty of this, eating through lunch, not taking breaks, working, long hours without adequate rest or without adequate recovery time. So that fast-paced lifestyle can be part of this as well. Lack of sunshine. Of course, lack of sunshine regulates hormone production, particularly cortisol production. So remember that the cortisol as it's produced, is a diurnal hormone. Let me make some room here, and we'll talk about that a little bit too. But cortisol is part of how cortisol is produced is through light. It's through predominantly sunlight. And there's a balance between cortisol and melatonin. And when you get especially morning time sunlight exposure, your body does really better at producing melatonin in adequate quantities to counterbalance cortisol. But if we look at cortisol and melatonin, so cortisol is supposed to be in the morning time. So if this is, AM, and this is lunch, and this is afternoon, and this is night, we look at, where does cortisol, how's cortisol produced? So in the morning time, cortisol is at its highest. Okay, and then as the day goes on, cortisol drops a little bit. And then as we get into the afternoon hours, cortisol drops a little bit more. And then as we get to nighttime, cortisol drops to its lowest point. And so it almost follows like a lazy curve, right? This lazy curve. This is what a cortisol curve looks like. So cortisol is not something that you can go to your doctor and have measured. A lot of times the doctors, they'll measure your cortisol, they'll draw your blood, right? And they'll measure this moment in time right here, but they don't measure these other moments in time. And it's very important to understand because cortisol follows a pattern. If you don't measure the different aspects of that pattern, then you could get a very misleading morning cortisol. It's not uncommon to see morning cortisol be normal, but to see the afternoon cortisol be too high, right? But if you're not measuring it, you never know. So like instead of the curve looking like this, sometimes what we'll see is the curve will look like this, and then it'll actually shoot up, and then it'll kind of drop at night, but it'll still stay high. So like you can get a curve that looks very, very different. And the problem with this is this would be an example of cortisol overall that's too high throughout the course of the day. And why is that a problem? Because when cortisol is high, if you have high cortisol elevates your blood sugar. And this is over time. So if this is happening consistently day in and day out, this is what will happen. It elevates your blood pressure. Okay, and high cortisol over time reduces your muscle. So it actually eats through muscle, and a high cortisol over time reduces your bone. That's why if you've ever taken cortisol or gone to your doctor and they prescribed it to you, usually they don't just say, here's cortisol, take it forever. They say, let me give it to you for 10 days. It's something called a menstrual dose pack, where they'll give it to you in high doses for a short period of time to prevent these types of problems from happening. Because if they gave it to you long term, one of the side effects is this right here. And so a lot of you, maybe you're on corticosteroids, maybe you're on a low dose cortisol-based steroid hormone, because some doctors do this anyway, despite these other risks. And again, then you end up with something like osteoporosis, right? Because we know cortisol elevations over time cause these problems. And so again, going back to if you're just measuring that morning cortisol only and you're not seeing that pattern as it evolves, because another pattern that we'll sometimes see is that cortisol be normal in the morning and then it'll drop, right? And it'll stay lower than what it should. And this is a classic example of a person who is tired all the time. Their cortisol, maybe they wake up and they feel okay, but their cortisol drops to such a great degree over the course of the day, they're tired all the time. Other patterns that we'll sometimes see, again, if you're measuring it in the morning, sometimes we'll also see a pattern where it is low in the morning, and that might be helpful, but again, it's only one reading, and so it'll be low in the morning and it'll spike at noon, and then it'll come down again in the afternoon, and then it'll go up again at night. And so what happens is you're tired in the morning when you're supposed to have energy, and then you're wired at night when you're supposed to be able to go to sleep. And so sometimes we refer to this up-down pattern with cortisol as wired and tired. These individuals, when they're supposed to be energetic, they're not, and when they're supposed to be sleepy, they're not. And so then a lot of times they evolve their mind, if this is happening to them over time, and they think that they're a night person, right? I'm just a night person. That's just who I am. You're not a night person. If this is happening to you, this is very much a hormone disruption, because remember, cortisol keeps your brain awake. That's why it's so important that cortisol drops at night. It allows your brain to fall asleep, and melatonin helps this process. So again, cortisol and melatonin, they really kind of counter each other. So when cortisol is high, melatonin is low, and when cortisol is low, melatonin generally is high. That's the pattern that these two, the dance, or if you will, the weave that these two play with each other. So it's important to understand that cortisol can't just be measured at one slot in the day. And this is, again, I've seen a lot of medical doctors be really guilty of this, and then they just dismiss the patient as not having an issue at all as it relates to their adrenal gland function. So again, stimulants can cause hyperexcretion of cortisol, adrenaline, and noradrenaline. Chronic, and I said as well, chronic prescription stimulants. Lack of sunshine for that reason. Sunshine balances, helps with melatonin regulation. And then we get lack of sleep. That lack of sleep can really affect how your adrenal glands are capable of functioning. They need that recovery at night. And if you're not sleeping to get that recovery, you're going to develop, long term, you're going to develop this adrenal fatigue issue. So these are all causes. So these are all, what's good about this chart is that you can change any one of these things, right? You have this freedom of choice to do any of the things as it relates to this list. So like if you have a chronic infection, you can make a choice to visit a doctor to get a diagnosis and to get it treated. If you have hypoglycemia, you can make a choice around eating. I hear this all the time. People say, I have hypoglycemia, I have this eating problem. No, you have hypoglycemia probably because you eat like garbage and your blood sugar doesn't know up from down. And if you exercised and you got proper sleep and you regulated your diet with real food, then hypoglycemia wouldn't be something you had. So again, it's one of those things that we can't say, I own this disease and I have it, and therefore I'm just going to be a victim to it. We have to own why we are struggling with this state. And so this is 100% adjustable. Chronic inflammation, you can find out what the triggers are. There are a number of different triggers to chronic inflammation, food being one of them, chemical exposures being another, microbial imbalance being another, nutritional deficiencies being another. Like those are 4 very common triggers for chronic inflammation. Same thing with chronic pain. Why does the chronic pain exist? Maybe you have an injury that needs to be rehabbed. Maybe your pain is in existence because you don't exercise enough and your muscles have atrophied and they've shrunk and now they're not limber enough, and so you get up to try to move them and they're stiff and you injure yourself, right? So movement and activity for many people is what's necessary to overcome chronic pain. Chronic stress, this can be emotional, right? Some people have emotional stress, and so sometimes you can control that and other times you can't control it as well. And so control it where you can and when you can. Otherwise, you run into big trouble. Now, I want to talk a little bit more about different types of stress because I think it's an important delineation for you as well. So many of you, we talk about good and bad stress, but what are the types of stress? There's emotional stress, which you can make choices here. You can choose who you hang out with. This is a big part of emotional stress, bad relationships or bad symbiotic communication. But there's emotional stress, that's one type. There's physical stress. And for most people, it's not too much exercise as much as it is too little exercise, because lack of physical activity is stress. It's just the wrong kind of stress. Because lack of physical activity tells your body to secrete hormones that break your muscle down because you're not using your muscle. And so therefore your body tells itself, we don't need all this muscle, let's deteriorate it and repurpose it and recycle it. And then there's chemical stress. And so physical stress is pretty easy. It's either too much or too little, or it's traumatic injury, right? Those are the primaries of physical. Emotional is generally relationships and spirituality. And then we have chemical stressors, and chemical stressors can be, what are the chemical stressors? Infection, microbial imbalance, nutritional deficiencies, chemical exposures. This could be something like a toxic heavy metal exposure or mold exposure or gluten sensitivity, because food and food reactivity is chemical, right? Because it's something you put in your body that affects you in a good or a bad way, so you get chemical stressors from food. So where most people struggle is right here. Now, a lot of people struggle here too. This oftentimes doesn't require like a super objective analytical chemical analysis. This just requires acknowledgement and addressing. And this just requires acknowledgement and addressing, and sometimes it requires counseling, and sometimes it requires kind of a deeper insight into oneself. But all these things are choices that you can make. You can choose to do counseling. You can choose to move more. You can choose to measure the potential for these things. And therefore, when you're doing that, you're choosing to identify what's causing or contributing to your chronic stress. And then subsequently, you can choose to change it and change the outcome, which again, in the case that we're talking about today, is this adrenal fatigue. So choices, you have them. You should exercise making them and to improve upon your situation. But sometimes we don't know what choices to make. Sometimes we don't have the knowledge or the skill set to understand what choices are best to make. That's where it's important, if you find yourself there, to get to work with a professional who understands these different things and really get to the bottom of it. So what are some of the symptoms? So, do you have adrenal fatigue? Again, because it's this nexus diagnosis. It's not really technically a diagnosis. Nobody in medicine will ever tell you that adrenal fatigue is a real thing. But how does it start? What are some of the things that really begin? And so this is kind of a list of symptoms that we can see that many people will develop. So again, not everybody has all of these symptoms. Not everybody will develop every single one of these symptoms, but these are things you can look at. Now, these things over here are more common. So one of them is chronic fatigue. That, in my experience, is probably the most common, is just chronic fatigue. What a person will oftentimes say is, 5 years ago, 6 years ago, I could work all night, I could play all day, I could stay up, I could drink, I could exercise, and I could cruise, and I wouldn't have any problems. Now, the smallest amount of stress completely wrecks me for 2 or 3 days, right? That's where that chronic fatigue starts to set in. What's happening here is a person is becoming stress maladapted, meaning their adrenal glands are starting to get tired because they've been overworked for too long. And this will also be accompanied with muscle weakness. And one of the reasons why is that, initially in some of the earlier stages of adrenal fatigue, so think of adrenal fatigue as not as, your adrenal glands are tired or they're not tired. Think of it, there are stages of what the adrenal glands go through. The initial stage of adrenal reaction is what we call the acute stress stage. Let's make some more room here. So you've got acute stress, which generally, if it's truly acute, meaning it lasts for a few days at most, it then goes your body. So acute stress, your body responds to acute stress by increasing cortisol and adrenaline. And as long as the stress goes away, right? When the stress goes away, this will drop and everything will come back to normal, okay? This is where the problem sets in, is when there's chronic stress. Stress lasting for weeks to months on end, and there's no reprieve, right? And so initially, again, with acute stress, these things go up. Your cortisol goes up, your adrenaline goes up. Those are things that initially will elevate. And in an attempt, your body, what it's trying to do is it's trying to make hormones that help you adapt and deal with stress. But if that stress stays there for too long, you'll actually see, so going back to this diagram, right, where cortisol kind of follows that curve, right? What you'll see with acute stress is instead of this curve, you might see a minor spike. But with chronic stress, what you're going to see a lot of times is that morning time cortisol is even higher. It's even higher. Sometimes I see it in people off the chart. And then we might get where it drops, and then we might get a spike in the course of the day. So you get instead of like the smooth downward trending curve, you might see it drop and then spike back up and then kind of drop again. Like that's a pattern. So there are different patterns with chronic stress. And so it's because your body is trying to adapt to the stress. So the longer it's there, your cortisol levels will start to yo-yo and they'll start to seesaw. And as that happens over time, initially that cortisol, that adrenaline are high, but the longer this goes on, beyond the with the chronic stress, the longer this goes on, these hormones will then they will really start to plunge, right? So instead of being high, they'll really start to plunge, and then you won't have adequate cortisol. And when you hit that point where your cortisol's on the floor, maybe your cortisol, instead of it being way up here and curved like that, it's just kind of flatlined, right? At the different times of the day, it doesn't really change. You know, there may be a 5 to 6 point differential in these as opposed to a 10-point differential. But this is more of a flat line, and this is when you're in bed all day. This is when you're tired all the time. This is when you wake up after sleeping for 8 or 9 or even 10 hours, and you still wake up tired, and you have a hard time peeling yourself out of bed. That's chronic stress, right? And this can take, you know, depending on the person, there are a lot of variables here because it depends on how well a person eats, whether they exercise, get sunshine, whether they go to bed on time, whether they're dealing with a lot of job stress, whether they're dealing with a lot of relationship stress. So like a lot of it is dependent on multiple factors, which can make it challenging and hard. But ultimately what happens, that person loses their ability to adapt to stress because they are flatlined. This is, you know, again, that stress maladaptation is because they flatline out their cortisol. They can't get a boost out of it, and so they can't function. And this is, you know, a lot of times where people, again, chronically, they're in bed. They don't want to get out of bed. They have chronic fatigue syndrome, CFS. They have muscle weakness. Their muscles are deteriorating. They're in bed. They're tired all the time. They're not exercising at all because they can't tolerate it. So exercise intolerance is a very common symptom of adrenal fatigue. And then we get, you know, we can get abdominal pain. And one of the reasons why they get the abdominal pain is because chronic stress hormone production and chronic stress shuts down the gut. It shuts down the motility. It shuts down how well you digest. Chronic stress reduces gastric acid secretion, reduces enzymatic production, so enzyme production by your pancreas and by your GI tract, so you don't digest your food as well. So now your food sits inside of you and it kind of rots inside of you, and that can lead to a lot of abdominal symptoms and pain. We also get weight loss. Initially, right? So in an earlier chronic stage, so again, this is where there's nuance to this. And so before you're completely maladapted to stress, there's a stage where it's predominantly, I'm tired all the time, but it's not weight loss. It's actually weight gain. Because initially, remember what I showed you a minute ago with that cortisol curve. Initially, let's move this out of the way again. You might be in a state of earlier chronic stress. Again, there are levels of chronic stress where your cortisol is way up here and it's staying higher. It's dropping in a normal type of pattern, but overall you're producing more of it to cope and adapt to the stress. And remember that too much cortisol, what does it cause? It causes muscle loss. It causes bone loss. It can elevate your blood sugar, right? Which leads to weight gain. So this is part of the, kind of an earlier, think of this as an earlier stage of the beginnings of adrenal fatigue, but multiply that over months to potentially out to a year, and that weight gain starts to deteriorate because you're losing muscle mass, you're losing bone mass, your appetite's not there because you just don't want to eat. And that's where this really starts to kick in. So a lot of times, again, earlier stages, we'll see weight gain, and then subsequently weight loss will come after that. And then these are some of the additional possible symptoms that we'll see sometimes people will manifest with: nausea, vomiting, diarrhea. So again, what are these? These are all GI symptoms. Your body's saying don't eat. We don't want the food because we're not doing anything with it because the stress hormones are shutting down the digestive tract. And so your body's trying to reject food. Lightheaded when standing up because, again, chronic stress can affect your blood pressure through mineral corticoids and hormones like aldosterone. Irritability and depression, joint pain, severe salt cravings. I hear this a lot. People crave salt. This is especially true in the later stages of adrenal fatigue. And then we get low blood sugar. Initially, it's high blood sugar, but over time, the blood sugar levels become hypoglycemic because people can't regulate how they're processing carbohydrates, and so they can't make energy from the food they're eating. Irregular menstrual cycles or no menstrual cycles, the chronic stress will shut down sex steroid production, and no interest in sex, so libido on the floor, and severe enough, you get darkening in the folds of the skin, so like in the elbows, the backs of the knees, the back of the neck, that skin will start to turn very, very dark. And that's not a good thing. That's a later stage. So problems with chronic stress. I've mentioned this a number of times, and this is where a lot of people are symptomatically. So it's these problems with chronic stress. And so some of the most commonly reported symptoms before a person gets that adrenal fatigue label, right, are these things start to happen. Okay, and we mentioned fatigue, we mentioned weight gain already, is water retention, right? If you've ever taken a corticosteroid, like the drug from the doctor, whether it was an injection or whether it was oral, one of the first things that happens is you put on like 5 to 10 pounds, and that's water weight retention, and that has to do with the electrolyte balance. And so a lot of people will actually be packing 10, 15 pounds of extra water when they've been chronically stressed because they're making their own steroid, right? And they're storing that excessive water. Muscle loss, bone loss, I mentioned. Elevations in blood pressure and blood sugar and low libido, also mentioned as well. So again, why does chronic stress cause these things? Because chronic stress drives up cortisol. That's what you do not want. You do not want your cortisol to be high. And remember, what is chronic stress? It's lack of sleep, it's diet, it's infection, it's all the things that we talked about that can drive the stress response. So it's important that you have a plan, right? Because if this is you, if you're here already, what's your plan to get out of here, to get away from this? You have to have a plan. What's the old saying? Failing to plan is planning to fail. And so for many people, the plan should look, before we get to this slide, I really want to talk about more of the plan as you should be thinking about it, right? So number one, sleep often. Sleep a lot, okay? When you're in adrenal fatigue and you've been struggling with it for a while, the regular 8-hour time framing around sleep is not, in many people's cases, effective enough. So we've got to get sleep. And this includes naps. So if you find yourself, dragging in the middle of the afternoon and you can't function, your brain can't think clearly, and your body's telling you to go to sleep, take a nap. We have this in America, we have this guilt complex around taking naps. We think somehow if we take a nap, indicates we're lazy or inadequate as a person. But nap is just nap feeling tired around the noon time is just your body's way of saying go to sleep. Now, a lot of cultures take naps anyway. They take a 20-minute siesta after eating. And the reason why is they just dumped a bunch of food in their GI tract. Instead of stressing themselves out by working, they can now go lay down for 20 minutes and let their body do that job of sending the blood to the GI tract and helping them digest the food so they can get good nutrition out of the food. But napping can be very effective. Sleeping a lot is what I would call a non-negotiable, right? It's a non-negotiable. You can't negotiate with sleep. You can't barter with it. You can't argue with it. You need it. And you need to make sure that you're getting it, especially if you suspect that you're in a state of adrenal fatigue. Number two is avoidance. What does that mean, avoidance? Avoidance of the things that you know are triggers, are your stress triggers. So avoidance could be food. And this is one of the things, if you don't know, get it measured. Get it tested. Because if you don't know, food could be your best friend or food could be your worst enemy. But if food is your worst enemy, remember the act of eating is designed to nourish the body. But if instead for you, the act of eating is causing inflammation, then it's just driving that stress response. So you really want to understand. One of the more common food elements here is gluten. If you don't know whether or not you need to go gluten-free, take our quiz. It's simple, it's free. I'll put a link into the feed for you where you can take that. And if you want to dive in deeper, you can do genetic testing as well. But avoidance of food, also avoidance of chemical toxins. We live in this polluted world, and many of you have traded your health for the convenience of that world. And so, examples of chemical toxins would be plastic water bottles, right? It's very convenient to be able to buy that and drink out of that plastic, but that plastic is a chemical toxin. That phthalate, even the BPA-free water bottles, there are phthalates in those water bottles that act as pseudoestrogens and chemicals that can stress out your endocrine system. So get rid of that stuff, right? Drink out of glass. Ideally, filter your water, filter your air. These are chemical toxins. You can filter them, you can control them, you can mitigate your exposure. It's very important that you make every attempt to do that. And there are other chemical toxins. We don't really oftentimes think of EMF as a chemical toxin, but many people with chronic fatigue and adrenal burnout have EMF hypersensitivity, meaning they can't be around Wi-Fi. They can't be, if you've got that phone in your hand and you're on it all the day and you're being constantly exposed to large quantities of EMF and you've become EMF intolerant because you're stress intolerant, it can be very hard to make a comeback. So turn the Wi-Fi off at night, like give yourself time away from it. So avoidance of the things that are poisoning you, right? And then we want to embrace the things that heal us. So what is this? This can be perceived in a lot of different ways. What do you want to embrace? You want to embrace real food. Real whole food, organic food, right? Because the pesticides and the other toxins that are found in a lot of the boxed and processed foods, what are those? Those are chemical toxins, right? Your body's overwhelmed. So eat real food. Not fake food. You can also embrace things like exercise to tolerance. Now, again, if you're chronically adrenal fatigued, you may not have much tolerance to exercise. All you may be able to do today is walk 800 meters to the mailbox and back. That's okay. Walk the 800 meters. Embrace what you can do. Don't be discouraged by what you can't, but embrace the things that you know are going to put you back on the right path. So, again, embracing exercise to tolerance, embracing spending time outdoors, outside. Being outside is a very healing thing. As a matter of fact, it's before the drug cartels took over health and medicine, spending time outside was a common prescribing practice of doctors because they knew that spending time in nature had healing aspects, even if they didn't understand what those were. We understand them a little bit better today. Certainly there's vitamin D. We know the healing aspect of the sun as it relates to the production of melatonin and endorphins. Sunshine can help your brain make endorphins, which help you feel better, which can block pain receptors, among other things. So it's an easy thing to embrace that. Embrace the people around you who you know care about you, but don't embrace the toxic relationships. Like, give yourself distance if you know there are toxic relationships that you're just putting up with. Those things are going to potentiate a complete lack of response in terms of trying to recover. So you really want to embrace things that help you heal. And that's sleep, sunshine, exercise to tolerance, the right relationships, eating real food, all critical, all non-negotiable. If you don't do those things, you're going to really, really struggle to make a comeback. Now, beyond those things, there are some supplements that can be very supportive of adrenal gland function, and I want to talk a little bit about some of those. This is not a comprehensive list, so if you are thinking in your head, why doesn't he have licorice on that list? This is not the end-all be-all list, but it's a list to get you started and going in the right direction. So some of the things I'm going to highlight, this over here, the vitamins and minerals, I'm going to highlight because these are the most important. These right here are more important than the adaptogens, the glandulars, and some of the other plant-based compounds, which is what these are, okay? These things here are essential for your adrenal glands to be able to function. You cannot adequately produce cortisol. Your body needs pantothenic acid. Pantothenic acid, it's vitamin B5. For those of you maybe that don't know, it's vitamin B5. Its nickname is the anti-stress factor because it combats stress by helping you produce the hormone that helps you cope and deal with stress. So if you don't have enough pantothenic acid, or if your vitamin B5 is deficient, you're going to really, really struggle. This is essential, right? These things are essential for function. These things are beneficial in the way that you feel, right? So vitamin C is absolutely critical. You can't make cortisol, and again, you can't make cortisol without vitamin C. So think of vitamin C and vitamin B5. That's why they're number 1 and number 2 on the list as the most important things that you could get more of. We know from numerous research studies that when stress goes up, vitamin C need goes up. And when we match stress to vitamin C intake, a lot of times we can keep people from even becoming sick. This is what we saw in the last 2 years with the intelligent doctors who were out there treating, this ubiquitous virus with vitamin C. They were treating it with vitamin C, and of course the people that got that did so much better in their recovery. It's because they were matching the stress of the infection with enough vitamin C to help combat it. And we know zinc. Zinc is very important in this regard as well. Zinc is important in the production of hormones. Now, if we're talking about this, up here we're talking about cortisol, but we can talk about the biochemistry of adrenaline production, which you need. For adrenaline, you need vitamin C. You also need copper, which is very important in that regard. And zinc and copper are important to take sometimes together because they balance each other out. We know we need B vitamins. Biotin's one of them. Vitamin B3, sometimes called in biochemistry NAD, in a nicotine adenine dinucleotide. This B vitamin is important for the production of cortisol as well. We also need, for adrenaline production, you need adequate protein. One of the things that happens with chronic stress is people's protein levels drop, especially if you're following some of the newer trends like the plant-based diet. If you're under tremendous stress and you start a plant-based diet and you're not getting adequate protein, it can actually put you to the floor. It can actually be the tipping point that breaks you. One of the things that comes in protein is tyrosine, which is a precursor to production of producing adrenaline. You also need vitamin B6 in that process. So these nutrients are very, very critical for the biochemistry of how your body is capable of producing cortisol and adrenaline. And if you don't have adequate quantities of them, but you continue to embark upon a high-stress lifestyle, this is what adrenal fatigue is you run out of these essentials, and that's when you flatline, that's when you crash. So it's very important. Again, the best thing to do is to measure these nutrients, and all these things can be measured. It's very simple to do. If the doctor understands nutrition, they can measure this, and then they can give you kind of a customized blueprint to follow in terms of helping you, because not everybody with adrenal fatigue needs to megadose with every one of these nutrients. Sometimes it's just a handful or a few of them. And then we have over here, we have some other things that can be beneficial that contain a lot of different types of flavonoids, but rooibos tea, this is one thing that you can do. It's a food. You can certainly eat it or rather drink it. Pomegranate is another. It's a food you can eat. Flax, cacao, green tea, and then adaptogens. And adaptogens like ginseng can be very helpful to helping the body cope with stress, as can glandulars. And glandulars are basically like eating organ meat. It's like eating adrenal meat. You're eating the organ meat. And so there are a lot of nutrients within the organ meat itself, right? There are a lot of nutrients. These nutrients are found in a lot of the glandulars. And so those are also things that can be very, very helpful. I've seen people who were on their couches every day, all day, tired, and using a glandular was the thing that got them to be able to get up off the couch and actually start functioning again and start taking some action to improve their health. So again, these are things that can be helpful, but I think it's important that you go back beyond these things and you really focus on making sure you're doing these other things first, right? Which is the sleep, the avoidance of the wrong foods and other trigger factors, and embracing things that help in the healing process. And that also, we didn't really talk much about it, but meditation can be very, very effective. Yoga can be very, very effective as a tolerable form of exercise. And then there's one other therapy I think worth mentioning, and that's sensory deprivation therapy, which is a type of it's basically, have you ever heard of a float tank? It's a large bathtub full of magnesium salt, and it's so much magnesium in the water that you float. You're buoyant, so your body floats. And you do this in a controlled environment where you're wearing blinders so you can't see, you're wearing earplugs so you can't hear. The temperature of the water is the same temperature as the core body temperature, so you're not feeling, and you're lying in water floating, so there's no gravitational force. So you're depriving yourself of sensation, of sight, of sound, of gravitational force and proprioception and temperature change. And so that's why it's called sensory deprivation. It reduces all of the external input, or a lot of the external input, so that your body doesn't have to process extra and it can just simply relax. And it can be extremely effective as a first-line tool if you're really struggling with chronic adrenal fatigue and you need something extra to help you overcome. So with all that being said, let's jump into the Q&A. In early 70s on growth hormones injections, now suffering adrenal fatigue. Any correlation? Any correlation with injecting growth hormones and adrenal fatigue, or any correlation between being 70 and adrenal fatigue? Terry, maybe clarify for me, but I'm going to answer what I think might be your question, and that is using growth hormones, injecting growth hormones does not solve the why as to what created the adrenal fatigue situation. And as a matter of fact, growth hormones can stimulate you in such a way that adds stress. And so if you don't have the proper nutrition for your body to respond appropriately to those growth hormone injections, you can actually make your condition worse. Okay, let's go down on, there we go. I was on high-dose prednisone to treat idiopathic thrombocytopenia for a year when I was 18 years old. I was never tested for celiac, but 25 years later, I was told I have celiac and have been gluten-free the last decade. I go through bouts of no energy, especially in the morning since the prednisone. Can I heal the adrenals? Yes. Stacy, start with the application of everything that we talked about tonight. And two, you might analyze the type of gluten-free diet that you're following. One of the reasons why I wrote No Grain, No Pain, and I'll put a link up to that in the feed here too. One of the reasons why I wrote the book was actually for celiac people. The celiac community, about 92% of them fail to fully heal or recover from the inflammation. And one of the reasons why is they do the gluten-free diet wrong. They avoid wheat, barley, and rye, but they're still being exposed to other grain-based glutens, and they don't even realize that those grain-based glutens are a problem. So they continue to struggle beyond their gluten-free diet because their gluten-free diet is incorrect. And so, Stacey, if you haven't read that and you haven't followed me for a while, I encourage you to read it. I think it'll help you gain a lot of insight into why what's happening is happening. Cortisol's high, it seems, at night, hard to sleep. So one of the things you can do at night to help with sleep if your cortisol is high is taking melatonin. And a lot of people don't really want to take melatonin because they think it's habit forming and could cause them to not be able to make their own melatonin. But there's a value to sleep above and beyond that fear. So if you're not, if the choices are I don't sleep versus melatonin helps me sleep, then melatonin might be the thing, at least in the short term, to help get you balanced back. But ultimately, and you can take other things as well. There are a number of different plant-based botanicals that can help, with cortisol at night when it's high. Things like ashwagandha. That's one of the big ones. Ashwagandha can be very, very helpful at night. L-theanine, GABA can be helpful at night. We actually have a formulation called Ultra Calm. And so that's where when people's cortisol generally at night is very high, they're also very irritable and very amped up. And so Ultra Calm was designed with several ingredients to kind of help bring you back down a little bit so that you can fall asleep and stay asleep and get the benefit of the sleep. Because when you're sleep deprived, it's really hard to make a recovery. And sometimes it's a vicious cycle where you're sleep deprived because you're adrenal fatigued, but your adrenal fatigue is driving your sleep deprivation. So until you actually sleep, it's hard to come out of that. Again, just a vicious cycle. Karen asked about chronic inflammation with fibro. Yeah, I check into mold. If you've been diagnosed with fibromyalgia, I've seen some study reports where as high as 92% of patients with fibromyalgia have a mold problem in their home. You definitely want to rule that out if you haven't already. And if you've got any musty smells or history of roof leaks or water damage in your house, mold could be right up the alley of what's causing or contributing to your fibro. Yeah, so Vicky's asking, I go to sleep easily, but upon waking feel anxious. Could this be due to cortisol? It can be. You could be making too much cortisol. And so there are a number of reasons why that can happen. Part of it can depend on how you're waking. So a lot of people wake up too early, and they stimulate their cortisol to go even higher by using like loud alarm clocks. It's actually one of the big culprits that I've seen in people where they use blaringly loud alarm clocks or aggressive wake-up tactics. What I would encourage you to try if you feel anxious when you're waking up is try a natural sunlight alarm clock. And what happens with these types of clocks is they're like sphere clocks that sit on a pedestal, and the sphere is a light, and it's a yellow color. So it turns on initially. It's very dim, but so like let's say you want to wake up at 7. So at like 6:30, it turns on and it's really dim and light yellow. But as the time marches on, it emulates a sunrise, and so it gets brighter and brighter yellow color, and it can help you wake up very, very naturally without the alarm aspect. And so some people find that that's enough to prevent that from happening. But there's other reasons why you might be waking up anxious. It could be that you're anxious about going to work, or depending on what your pattern is in the morning. Some people are anxious about what the day holds for them. And then other people have, other things that can cause that anxiety. So there are a number of different things that can drive anxiety, but food allergy is a big one. In my experience, mold. If you're sleeping in mold, I know I harp a lot on mold with a lot of you guys, but if you're in mold and you're sleeping in a moldy environment, then you have something that is chronically stimulating your immune system and chronically putting you into a fight or flight state. And so when you do wake up, your body's feeling that, and it's alarming you to escape, to get out of the environment. So Cindy asks, how do you recover? You can't exercise much at all because your body's already stressed. Good food, rest. What type of exercise? How do we do enough without doing too much? That's a great question. The answer, no doctor can give it to you. Because exercise is done to tolerance. And so what I would suggest, when you're chronically tired like this, what maybe you used to be able to accomplish in your exercise, you're far away from that today, right? And so always err on the side of caution when introducing exercise to tolerance. Always do less than you think you might be capable of, and just to see how your body handles it. Right? And once you know how your body handles it, you can adjust incrementally up and or down depending on what that looks like. But you've got to take it very slow. My point is, when you're in adrenal fatigue, don't get in a big hurry, to try to ramp your exercise up too quickly. You've got to be super patient and take your time and be patient with yourself and give yourself grace. How do you get rid of BPA accumulation in the body? Well, the number one rule of detox, Moriana, is to not retox. So quit exposing yourself to it is number one, and your body will push it out as time goes on. There are certainly things you can do to support your liver. N-acetylcysteine, glutathione, vitamin C are all good options supplementally to help support your liver's ability to detoxify. So you can attempt any of those things. Okay, let's keep going down on that left side. Dennis is asking, do psychostimulants cause adrenal dysfunction? Yeah, psychostimulants can certainly overstimulate your adrenals and put them in a position where they begin to wear down. And so, I'm not going to say that they're the only cause, but they certainly can contribute to it. Mary asks, I heard a doctor say that women who've had a complete hysterectomy or are postmenopausal have their adrenal glands doing what the ovaries used to do. This is correct. How can the stress created by that and the added hormonal stresses be overcome naturally? Well, you have to understand, if you've had a complete hysterectomy, you can never get the organ back, so there's always going to be a degree of loss there that won't be 100%. But you have to adapt your lifestyle so that there is, again, most people live their lifestyles in a position where they're overly stressed and underly rested, right? It's this imbalance between parasympathetic and sympathetic nervous system dominance. And so you have to look at what in your life is contributing to sympathetic dominance, and you really have to take action steps to mitigate that. I mean, I can't emphasize that enough. That's what you can do. That's the number one thing that you can do. If you're doing that and you're still struggling, now there are a number of different botanicals that act as adaptogenic agents, and that includes adaptogens around estrogens and progesterones and adrenal adaptogens, and those things can be used, and you can work with a good healthcare provider who has a deep understanding of those things to help you make up the gap, so to speak, if you've had that hysterectomy or you've had, or if you're, post-menopause. But my opinion on post-menopause is it's not a disease state. Post-menopausal women can be just fine. If you've still got your ovaries and your uterus, you can be just fine. Yes, there is a natural decline in hormone output postmenopausally, but that doesn't mean it's a disease state. A lot of doctors try to treat that as if it's a disease state and think that by giving extra hormones, they're creating longevity for people. And some would argue that is to a certain extent true. I would argue that it's up to you to make those decisions and up to where your quality of life is as to whether those decisions are worth making for you. So, question on why can't my body not sleep or relax without background noise? It's been this way for 6 years. I have to sleep with an audiobook in my ears or sounds. It's that way for many people because the sound drowns out the thoughts. And this is true. I see this a lot. It's very common in women, where women generally are more cerebral. So at night, they struggle more with sleep than, say, men. Men just generally can move on and forget about things. Women are processors. Their brain has to process and think and think and think and think. And sometimes it's doing it subconsciously when you're supposed to be sleeping. And so that white noise, that background noise, or that audio book may be the thing that's distracting you from having to do the processing, which is really allowing you to hit the state of relaxation. Some people get the same effect through meditation, where they meditate themselves into that same kind of brainwave state where they can now fall asleep or prep for sleep. But I would argue that what you're experiencing with your audiobook is almost like a form of meditation. A lot of people don't recognize it as such, but it can have the same type of effect on brainwaves. Okay, let's go down more on the left. Can tapping help with adrenal drainage? Adrenal drainage, your adrenal glands don't necessarily need to drain so much. If you're talking about lymphatic drainage, I think tapping, where the benefit of tapping is, depending on if you're doing it properly, is you're actually hitting energy points on the body that can have profound physiological effects. So tapping can be a very effective adjuvant to helping with stress, and a lot of people have found tremendous benefit in tapping. I think it also depends on the individual, because some people try to tap and it doesn't work well for them. So is there a connection between adrenals and low immune system, blood sugar dysregulation, and low blood pressure? Yes, that's adrenal fatigue. What you're describing are the symptoms of adrenal fatigue, and the solution is starting with what I talked about tonight and really trying to embark upon many of those lifestyle changes first. Should you work on adrenals or thyroid first? Both. You should work on them both if you've got a problem in both, Nicole. I see this a lot in people. They make the mistake of piecemealing their choices, right, as to what they're going to work on. So, and I see this even with doctors. They say, work on the adrenals first, work on the gut first. Look, if you've got an adrenal problem, if you've got a thyroid problem, you've got a gut problem, you've got a muscle problem, there's no order. You work on them all. And so you prioritize them all because there's a problem in all of them. And so, the body works as a whole holistic unit. It doesn't work in pieces. So I think it's a mistake to just focus on one area and just work on that one area. I think you really have to address it all together. I like that. Hello from a semi-truck on I-80 in Pennsylvania. Mikhail. Thanks for tuning in, Mikhail. Why do I startle so easy that I get chest pain? Well, your blood pressure's going up, and it's probably putting pressure on your heart. Adrenaline puts pressure on the heart, and it can create chest pain. I also have very low blood pressure. So that may be it, is that you're getting that startle is easy, and so it's driving up that low blood pressure, and it's putting more pressure on your heart immediately, and that could be a reason why you're experiencing that. Can I take a supplement that has DGL, deglycerinized licorice is what I'm assuming that you mean if I have high cortisol? Yes, you can, but in my opinion, you should be having, if you've got an abnormal pattern of cortisol, you should really be working with somebody who understands, how to help that balance out, because just taking DGL is not going to be a solution for anyone. So Magnus says, I have been feeling weird. I have celiac disease, and for 2 days now my heart has been racing, but it's fine. Dizzy, and I have gastritis. I'm not sure I follow, but it's fine, dizzy, and I have gastritis. Can all this be my adrenal glands? The dizziness can certainly be your adrenal glands. The heart racing can certainly be your adrenal glands. It can be other things as well. Gastritis, you're eating something that's still irritating you, Magda. I don't know if you're following no grain, no pain, but again, because you have celiac disease and somebody with celiac do the diet wrong because they just never were properly instructed on how to do it, I would strongly encourage you to check out No Grain, No Pain. Can burdock root help alleviate stress? I don't have a whole lot of experience, Russ, with using burdock root to help people alleviate stress, so I don't want to comment with a lack of experience using that particular herbal. How important are vitamin C and vitamin E for the adrenal glands? I think I mentioned vitamin C already. Vitamin E is important for systemic function of the body, but it doesn't play a specific major role in adrenal gland biochemistry. Susan says, great topic. I had spring fatigue badly. I started daily vitamins, getting outside more, and strictly adhering to my gluten-free diet. It took some time, but my energy is back up. How can I address losing weight on a whole food gluten-free diet? So weight should not be the focus of what you're trying to address, Susan. Not to say that it isn't important to you. It's just simply to say that health, if your emphasis on your choices is health, then your weight loss will follow. And I see that time and time again in thousands of people where I generally try not to get them centrically focused around their weight and more specifically focused around their health. So if you're struggling with weight, I'd encourage you to go back and watch some of my past episodes on weight loss and weight loss strategies, because it's a pretty in-depth topic, and I think your answer could be best served in an in-depth way than just in a blip. How can I find a doctor that will actually address all these areas? Yeah, good question, Judy. There's not very many of them in my experience. Medicine, this is just my humble opinion today, medicine's broken. Most doctors that go to medical school, there's no nutrition being taught. It's the fundamentals of pharmacology. And if you want drugs to solve your symptoms, it's a great place to be. Go visit a medical doctor. But it's a very frustrating place because so many of you that follow and listen in, you don't want that. You don't want to be mitigated with or have your symptoms mitigated by chemical manipulation. You want a real solution. You want a viable answer. And that's where some of the best ways to find a doctor is word of mouth. Like other people in your community that have maybe visited a good doctor locally that have found a traumatic change in their health through these types of practices. That would be probably the best way to find it. You can always call our office too. and set up a Zoom consultation if you'd like to. And if it's, if it looks like a good fit for you, you can move forward. Let's see here. Robert says, got to have my coffee, can't give that up. Are there supplements to lower cortisol? It's not that there are really supplements that lower cortisol. There are supplements that can help you cope and adapt to stress. So these are known as adaptogenic supplements that can interfere with the way cortisol works in a more natural way. But I don't know that I would rely on supplements to lower cortisol. If your cortisol is high, I'd want to figure out why it's high and first address that. And caffeine in that coffee can be a reason why, not for everyone. I'm not saying to say everybody needs to stop drinking coffee 100%, but a lot of people overdo the coffee, right? Instead of drinking just a normal sized cup, they're pounding 20 ounces of pot of coffee in the morning and another couple of cups in the afternoon to get a charge. If you're doing that, the odds that you're in adrenal fatigue is very, very high. You're using caffeine as a stimulant to get through your day, and that's one of the symptoms of adrenal fatigue. Betty says, I was on steroids for years and have small amounts of osteoporosis and taking some supplements and exercise. Any other things I can do? Betty, one of the best things that you can do if you were on steroids for years is get with a nutrition doc and have them check your vitamin and mineral status, because chronic steroid use depletes magnesium, depletes calcium, depletes zinc, depletes vitamin D. And so looking at those, and it also depletes vitamin C, so looking at those and more would be very critical to help you understand what more you can do nutritionally to support your bone remineralization and growth. Will fixing my adrenal function improve osteoporosis? It can. There are definitely linkages between the two. But osteoporosis is multifactorial as well. So it's not just fix the adrenals and your osteoporosis goes away. It's ask why you have osteoporosis, ask why you have adrenal dysfunction, and address the why, as opposed to not, right? Because that's where people get into trouble too, is they never ask why. They just ask, what can I do, without asking, why do I need to do these things? Or why is this happening to me? Why are these symptoms there? Why did that organ begin to fail? Why is the most important question that you can ask. Any scientific medical validity on the concoction of cream of tartar, sea salt, vitamin C, and orange juice to help adrenals? The only scientific validity there would be you could remove the cream of tartar, you could keep the sea salt, and you could keep the vitamin C. You could get rid of the orange juice and just use vitamin C and water, and you would have the same outcome or impact. And that's because vitamin C is tremendously beneficial for adrenal gland function, as is salt. Many people with hypoadrenal function are salt deprived. We live in this salt, fearing of salt society. Everybody fears salt for the fear of the high blood pressure, but really salt never caused high blood pressure. Chemical MSG and processed food are the primary drivers of high blood pressure, not actual salt. So I think doctors, just like their fear of the sun, and there are a lot of generalized fears that doctors have that make no sense. Like, don't go outside because sunshine will give you cancer, even though most skin cancers occur in areas where we get the least amount of sun exposure. What are some other common examples of doctor phobia? Don't go on a restricted diet because you'll hurt yourself. Like, a gluten-free diet is somehow dangerous. It's nonsense. And again, if they understood nutrition, then they wouldn't speak in those ways. It's just unfortunate that they are put on a pedestal by the vast majority of society when they know the least about health. They know the most about chemical manipulation, and they know the least about health. So if you're talking about health restoration, in my opinion, a hospital and a doctor's office are probably two of the worst places that you could be. Is collagen a good thing for celiacs to take? It can be. Collagen can be very helpful as a protein. Many celiacs have low protein and have been malnourished for years, and so collagen as supplemental can be very effective. You can get collagen from food as well. But yes, is a simple way to answer that question. Can lifelong coffee drinkers reverse adrenal fatigue, cortisol issues? Yes. You sure can. Again, anything that, a lot of people lose hope, and I understand. I can understand why. Sometimes it can be a challenge. You're struggling and you're trying to figure out answers to your health problems, and you run against brick wall after brick wall. And most doctors are again, not much help oftentimes, and so you end up in this state where you feel like, is there any hope? And I just want to say, anything that breaks down in your body can be repaired by your body. Your body has innate intelligence imbued by God, so it's the ultimate power. You have to tap into that power. And one of the ways you have to tap into that power is through belief, through hope. You have to have the right psychology. So don't ever lose hope. Number two is you have to have behavior change. You have to embrace behavior change. There's a psychology to getting better for many people, and that is the level of pain, discomfort, or disease has to outpace your fear of change. And if that is true, then you can make and embrace the change, because there's only up to go. You only have upward to go. You're at the bottom already. So don't lose hope. Stay the course. Yes, you can heal, and that is true of any question that comes in. Anyone who ever asks, can this heal, can that heal, can this heal? Yeah, the answer is yes to all of them. The only time we can't heal something is if you've had an organ removed. So we can't grow a new adrenal gland. We can't grow a new kidney. Now, one of your kidneys might grow bigger. You can't grow a new colon if you've had part of it removed. You can't regrow ovaries, right? So surgical removal of organs and glands, you can't change that, but it still doesn't mean that your body's function can't improve. But that's really the only thing that we can't grow back, right, is when we have surgical removal of something. Karen's asking, follow up to the mold. Is there a mold test I can take to rule in or out mold? Yeah, Karen, mycotoxin testing is probably one of the best ways to understand whether or not you have an environmental mold problem. So I would encourage you to check that out. Let's see here. So Aaron's asking about, in regards to hormonal imbalance and chemicals causing adrenal dysfunction, how does HRT, hormone replacement therapy, affect adrenal function? It's a very complicated question, Aaron, and even is specifically about estrogen. So it depends, because a lot of women are taking HRT and don't need it. And they're taking it to mitigate other symptoms. And some women have actually had their estrogen levels checked, and they're constantly being monitored and being tested. And so they're on HRT, and they're keeping their levels balanced within what's known as a physiological range. In essence, let's say you've had your ovaries removed and your doctor put you on hormone replacement estrogen. Because of that, and they're regulating that dose, and they're regulating the quantity floating around in your bloodstream to try to emulate what your body could naturally produce. In that regard, that could actually have beneficial effects, but taking too much estrogen and creating an estrogen imbalance or hyperestrogenism could have negative effects. So it just depends on the reason and how closely you're having that monitored. Is it a blood test for mold? Mycotoxin testing is what again, going back to that, mycotoxin, that's urine testing. Advice to address EMF sensitivities and adrenal fatigue in addition to avoidance. No, Rita, avoidance is the only way. And I know that sounds, for some of you, may sound really challenging, because everywhere you go, there's going to be some degree of Wi-Fi around you, some degree of EMF around you. I think where you really can control it best, Rita, is in your home, is hardwire everything. You can hardwire your internet to your computers and other devices, and you can hardwire those, and you can reduce dramatically the quantity of EMF exposure. Other things that you can do is you can buy an EMF reader, a tricord reader that measures pockets in your house that may have higher levels of EMF. So for example, maybe you have an outlet behind your bed that emits an EMF field, and you're sleeping there every night and it's hitting your head, and that could be a part of the problem. But if you have a meter where you can actually measure and detect levels, because these are unseen energies, at least unseen to the human eye, then it may allow you to position your bed in a different location. Or if if you have a favorite place to sit in the evening, and there's a pocket of EMF around that chair, you may particularly identify that and be able to move the furniture a little bit in your favor. So there are a lot of different strategies there that maybe you haven't tapped into that you could try. Let's see. Let's go down on the right. A friend of mine lost a kidney and an adrenal gland to cancer. He was in remission for 5 years and then got jabbed and boosted and the cancer returned. That's a big problem. That's a big, big problem, Mark. And that's your friend is not the only person that we've seen that in. The cancer rates, I think, we're going to see astronomically rising over the next several years as a result of what's going on. What do you say to people who use alcohol to deal with stress? I don't. And I understand the position. It's, people that use alcohol to deal with stress, it depends on who they are, right? So if they're coming to me and they're saying, Dr. Osborne, I need your help. Can you help me? Then I'm going to hit them in between the eyes, like, not literally, but with the truth, with the honesty. Alcohol doesn't help. Alcohol is a coping mechanism. We have to find other coping mechanisms. We have to do things differently, right? But if it's a family member, or if it's somebody, at home, and you're trying to, and I'm not saying you're doing this, but it's not. Sometimes our intentions are not. What we have as intentions in our heart are not the perceptions that other people garner from the conversation. So, like you telling somebody they need to quit drinking because it damages their adrenal glands, maybe perceived as nagging. And that won't help. That will only create a wedge in a relationship and drive a person further into that bottle, possibly, right? So part of it is, that's why I say I wouldn't say anything to somebody. I generally don't make a habit of trying to give health advice to people who don't come to see me directly, unless I'm talking generalizations on Monday night show, in which, I try to help everybody a little bit. But when it comes to family members, you might plant some seeds, but I would be real cautious about how you do that, because generally speaking, in families don't respect other family members' opinions about their health. It's just not something, they're not coming to you for expert advice there. And so you've got to be real cautious about how you approach it. Okay, I think we need to start looking at wrapping it up. I think a couple of kind of last second deals here. One on night shifts. Do people who work night shifts tend to have adrenal fatigue? They are at greater risk, GN, night shift workers. I worked night shifts for years in the military. Definitely affected me. But yeah, they tend to have a greater degree of potential there. Did you say we could do a Zoom consult through your office? Yes, Magda, you can. You can reach out to my office. Maybe we can drop a number in, 281-240-2229. You can reach out and you can set something like that up. Okay, I think I'm going to go home and eat. I think you should do the same thing if you haven't already, and hope your meal is great, and hope your week is great. And if you want more, if you're new to the show and you want more, we do this every Monday night. It's a live Q&A. Every Monday night we cover a deep and in-depth topic. But come visit me at glutenfreesociety.org. Make sure you're signed up there for our newsletter. It's free. Send you a lot of information, including link access to Monday night's shows. So if you want to get reminders, it's the best place to go sign up and make sure you get reminders. So hope you have a fantastic week. We'll see you next Monday for another episode of Pick Dr. Osborne's Brain. Take care. Hey, don't forget to tune in next week, same time, 6 p.m. Central Standard Time, for another Pick Dr. Osborne's Brain show. Bring all your toughest health questions to me. I look forward to answering them. And before you leave today, make sure you hit subscribe. And once you do, click that bell. That bell is going to allow us to remind you right before we go live. But it's also going to allow us to remind you when we come out with other video content all week long. We've got lots of episodes coming your way all week long, and I don't want you to miss anything. So again, subscribe, hit that bell so that you can get notified when we have that new information put up for you. Thanks so much, and I'm wishing you excellent health. Have a great week. We'll see you next Monday night.